Thank you for watching the video. This is YouTube Medical University. Lately I feel like I've been gaining weight more easily. Even though I should be getting enough sleep, I just can't seem to shake off the fatigue. I frequently wake up during the night and experience shallow sleep. You might think these problems are simply due to aging. Many of you may have given up, thinking it's hopeless. But what if the cause is actually coming from inside your body? What if the cause is a hormone, specifically growth hormone? Have you ever heard of growth hormone? The popular comedian Yoshiko from Ganbareruya developed a disease where this growth hormone goes out of control called acromegaly, and it was reported on television news. Acromegaly is caused by a brain tumor. It's a disease that slowly but surely damages the body, causes physical problems, and changes the shape of the body. Growth hormone is actually a very important hormone not only for children but also for adults, so that everyone can live vibrantly and true to themselves in the second half of their lives, enjoying delicious food. I will introduce scientifically proven lifestyle habits that make it easier to secrete growth hormone. By watching this video until the end, you'll be able to learn the science and knowledge of illnesses. Learning about acromegaly can help you detect illnesses early in yourself or loved ones. Making growth hormone your ally can also provide insights for living more authentically. In part 1, I'll explain acromegaly from a doctor's perspective. Then in part 2, I'll share methods to stimulate growth hormone secretion to help you be your best self. So, let's start with the first part. What kind of disease is acromegaly? Is it a disease where your fingertips keep getting bigger? It's a little hard to imagine just from the name, isn't it? First, please take a look at this image. This is a photo of a patient with acromegaly. This happens because our bodies secrete too much growth hormone, which normally helps maintain our bodies. In most cases, the cause is a part of the brain called the pituitary gland, which is shaped like a small nut. A benign tumor forms here. When a large, lumpy tumor develops, it causes the pituitary gland to release too much growth hormone. Since it's a growth hormone, if a child gets this disease, their bones will keep growing along with their growth period, leading to pituitary gigantism. That's what it's called. If it develops in adulthood actually, human bones have something called growth plates, and once those close, even if growth hormone is released, your height won't keep increasing. Instead, if it develops in adulthood, some unexpected symptoms can appear. These symptoms show up in your appearance. As signs, bones don't lengthen, but the periosteum membrane around them can thicken or deform, and cartilage can enlarge. Shoe size might increase, finger bones can thicken, and a once well-fitting wedding ring might not come off. Protruding facial features can also change. The bony parts, like the nose or the cheekbones under the eyes, can start to protrude, which causes changes in your face and appearance. Yoshiko from Ganbareruya also. It was memorable that she complained about her jaw protruding a bit forward, but that's not all. The tongue as well. Some people also suffer from symptoms where their tongue becomes thicker, making their pronunciation worse. Acromegaly has visible and invisible signs. If you're unaware of the less apparent symptoms, it can go unnoticed. Am I just tired lately? Or is it because of my age that it's getting harder to lose weight? My blood pressure has risen and I'm experiencing insomnia. These symptoms are appearing, so let's examine them individually. Growth hormone actually has the effect of increasing blood sugar levels. In order for us to grow, our blood sugar levels need to rise so that our cells can use it as energy, right? That's why growth hormone increases blood sugar levels. So, there are reports that about half of patients who develop acromegaly experience abnormal glucose metabolism, or changes similar to diabetes. That's the case. And what's more, the heart itself can become enlarged due to the effects of growth hormone, and sometimes this can lead to a condition called cardiomyopathy. When that happens, it puts a strain on all the blood vessels in the body, which can cause high blood pressure. And some people may develop heart failure, where they get short of breath or tired easily even after walking just a little. And also, I mentioned the symptom of waking up in the middle of the night, and that's because it's easy to develop something called sleep apnea syndrome. When you develop acromegaly, your tongue and the tissues in the back of your throat become enlarged, so the airway passage when you're sleeping gets narrower. Especially when you're lying on your back at night, your tongue falls back and blocks the airway so you can't breathe while you're sleeping, and you wake up gasping for air. These are the kinds of symptoms that appear. Sleep apnea syndrome isn't just about having trouble sleeping at night. It raises the risk of various diseases, such as arteriosclerosis, hypertension, diabetes, high cholesterol, and lipid disorders. Reports confirm that acromegaly can cause various diseases and accelerate arteriosclerosis progression. This can lead to things like heart disease or brain disease, making you more susceptible to these conditions. This might come as a surprise to many people. There are also reports that the risk of cancer increases. In fact, when too much growth hormone is secreted, there are even reports that the risk of colon cancer goes up. And Yoshiko from Ganbare-ruya was found to have an unusual symptom where a tumor in the pituitary gland, which is located behind the area between the eyebrows, pressed on the optic nerve, the nerve for the eyes, making it difficult to see out of one side of her visual field. Honestly, this means the disease had already progressed quite a bit. This is a sign, so I think it's best if you can detect it before these kinds of symptoms appear. Please make a note of the symptoms I just mentioned, or leave a comment in the comment section so you can look back at it later if you're unsure. That would be helpful. The interview video about Yoshiko from Ganbare-ruya and her acromegaly is linked in the description or comments. If you're interested, please check it out after this. At YouTube Medical University like this, as a doctor we responsibly share accurate, easy to understand information to help with early disease detection. Please subscribe so you don't miss new videos. For more, visit Medical Doc. Now, in the second period, how can you control growth hormones to bring out the best in yourself? This is a talk about scientific lifestyle habits. If you thought that growth hormones running wild can cause really scary diseases, don't worry. As long as they're secreted properly, growth hormones are actually very important self-care hormones that help maintain your body. These growth hormones, they work while we are sleeping, so what do they do for us? First, they repair damaged cells and muscles. Second, they burn and break down stored fat. They have such diet effects. Third, they promote skin turnover, helping you achieve healthier skin. And fourth, they play a role in maintaining brain function and stabilizing your mind, acting as mental care. That's amazing, isn't it? Growth hormones. They're not just important for children. It's not a hormone that's only important for children. So how we can make the most of this growth hormone is the key to living youthfully and energetically. In the second part, I'll introduce 4 ways to activate this growth hormone. How to activate growth hormone. Here is the first of the 4 methods. It's resistance exercise. Resistance exercise might sound like a difficult word, but it's simple. It means exercises that put a load on your muscles. In other words, strength training, or even if you don't lift heavy things, body weight training like squatting down a bit or movements similar to squats that really contract your muscles are said to be important for growth hormone. That's because growth hormone repairs damaged cells and muscles. So when your muscles or cells are damaged, this growth hormone is secreted, which means that destruction and creation are both important. So by putting stress on your muscles and causing some minor damage to your muscle cells, that's how we build muscle, and growth hormone is released along with it. For example, as an action plan, how about trying squats 3 times a week, doing 20 reps each time, or even just 10 reps is fine. If you have knee, hip or lower back pain and squats are difficult, please don't push yourself. In that case, I think it's a good idea to consult with a rehabilitation specialist or your primary doctor to find exercises that are easier for you to do. For example, you could try squats while holding onto a table, making sure not to overdo it. Even if you can't squat deeply like someone who is still active, just bending your knees a little is fine. Doing what you can is appropriate. The muscles in your legs are the largest in your body, so if you're going to train, working on your leg muscles is the most efficient way. I think this is a way to promote the release of growth hormone. For example, while sitting, try extending and bending one leg at the knee 10 times. If this is your knee, just extending and bending it 10 times can make a big difference. If you place your other leg on top of the working leg and extend it like this, it adds quite a bit of resistance, so if squats are difficult for you, just extending your knee can help you train your large leg muscles. Please give it a try. Also, please share the exercises you do in the comments section. I think it will be helpful for others. 4 ways to activate growth hormone. The second one is intermittent fasting. Hunger is the best spice. You've heard the saying that food tastes great when you're hungry, right? It's true, but that's not what I'm talking about this time. When your body is in a state of starvation, at times like that, we secrete growth hormone. The reason is that growth hormone has the effect of raising blood sugar levels. When we're hungry, our bodies work to raise blood sugar, so we don't become hypoglycemic. It's believed that growth hormone is actually being secreted at that time as well. There's a study like this. A group that fasted for 2 days had 3 times the amount of growth hormone secretion compared to people living their normal lives. It's amazing that just by not eating for 2 days, growth hormone increases threefold. But honestly, not eating for 2 days is a bit too much. There are also risks like hypoglycemia. Personally, I try not to eat too much before going to bed at night. That's because growth hormone is secreted while you're sleeping. So if your blood sugar is too high while you're sleeping, growth hormone tends to slack off and not get secreted as much. So before going to bed at night, if possible, try to fast for 3 to 4 hours. Not eating before bed helps growth hormone get secreted more efficiently. For example, if you go to bed at 10 p.m., that's 4 hours before, so it's best to finish dinner around 6 p.m. or at least by 7 p.m. Just being mindful of this can really change how tired your body feels and improve your sleep quality. Also, if you eat too much right before bed, your body has to digest food while you're sleeping. Then, if you eat breakfast right after waking up, your intestines never get a break. So, to give your stomach and intestines a rest, it's better to avoid eating right before going to bed. 4 ways to activate growth hormone. The third one is this: mindfulness. Mindfulness. Have you all heard of it? This is one of the meditation techniques where you learn Buddhist breathing methods or ways of meditating to calm your mind. Actually, mental stress can disrupt the secretion of this hormone. On the other hand, habits that relax your mind and body help regulate the autonomic nervous system and normalize hormone secretion. So, taking care of your mental health and your autonomic nervous system is important. That's why mindfulness is now getting a lot of attention. In one study, participants underwent 12 weeks of yoga training. The yoga group showed a significantly higher increase in growth hormone levels compared to the non-yoga group, according to reports. So, what exactly should you do to practice mindfulness? Let me introduce the method I actually use. It's called breathing meditation. In other words, it's meditation where you focus on your breath. Meditation requires you to clear all distracting thoughts from your mind, but if someone tells you not to think about anything, you end up thinking about all sorts of things, right? You might start thinking about what to have for dinner or that you have work tomorrow. That's why it's hard not to think about anything. Instead, breathing meditation is about focusing only on your breath and not thinking about anything else. Try a simple breathing meditation before bed to calm your mind. Inhale slowly through your nose for about 4 seconds. Then exhale through your mouth, taking twice as long as you did inhaling. Even just 5 minutes can make a difference. Then, slowly exhale for about 8 seconds. Repeat breathing in through your nose and slowly exhaling through your mouth. When you do this, you'll start to notice the sensation of air coming in through your nose, especially if you close your eyes. You'll notice the air entering your nose and then, with your eyes closed, slowly exhale. The air slowly leaves your mouth. Focus on those physical sensations, the subtle changes in how your nose and mouth feel. Try to concentrate only on these sensations. At first, if you're not used to it, you'll end up thinking about other things. You might wonder if doing this even has any meaning, or start worrying about tomorrow morning. Like realizing you forgot to take out the trash or didn't gather it up yet. When that happens, just notice, oh, I was thinking about something else. If you notice your mind wandering, refocus on your breathing. Try this practice for a minute, even if you're skeptical. You'll likely feel a bit clearer afterward. I hope you'll all give it a try. If you have any meditation techniques, please share them in the comments. And if you try this breathing meditation, let me know your thoughts as well. Now let's talk about activating growth hormones. 4 methods. The 4th is improving your sleep. I mentioned that the time when growth hormone is secreted the most is while you're sleeping. But actually, within that, there's what's called the golden time, which is said to be the first 90 minutes to 3 hours after you fall asleep. In other words, the time right after you fall asleep is the golden time for growth hormone. So, if you have trouble falling asleep or you wake up soon after falling asleep, it's harder for your body to secrete growth hormone. That's why it's crucial to discover methods to fall asleep more easily. We've already released videos about sleep in the past on YouTube Medical University, so if you're interested, please check those out as well. We've also introduced a sleep method that helped 98% of people sleep soundly. So in this video, I'm going to introduce some surprising and lesser known methods that I personally use to improve my sleep. The method is to warm up your feet and then let the heat escape from them. Some people might not like this method, but you know how it feels uncomfortable when your feet are cold right before bed, right? That's That's why curling up under the covers to warm your feet does feel nice and cozy. However, if you use something like a hot water bottle and cover your feet with a warm blanket as you fall asleep, your feet will keep getting warmer and warmer while you sleep. Then your body temperature rises and the heat can't escape, causing the heat to get trapped in your body. When that happens, your body gets too warm and the quality of your sleep goes down. On the other hand, if your body temperature starts out high and then gradually drops, that's when we naturally fall asleep. That's why it's good to take a relaxing bath before bed, or even warm your feet with a hot water bottle beforehand. Once your feet feel warm, get into bed. After you get into bed, if possible, try to keep your feet out from under the covers. The soles of your feet actually have a lot of tiny blood vessels. In other words, if you stick your feet out while you're sleeping, heat will be released efficiently from your feet, so your body temperature will gradually go down. If it gets too cold, your blood vessels will constrict to keep your body from losing any more heat. By doing this, you'll fall asleep more easily, and after you fall asleep, you'll naturally enter a deeper sleep, which helps promote the secretion of growth hormones. Recommended methods to keep feet warm include soaking in a bathtub or wearing leg warmers after taking a bath. These methods can help. Are available, so please give them a try. What did you think? This time I explained about a disease caused by the secretion of growth hormone called acromegaly, and introduced ways to effectively activate growth hormone, which is the cause of this, so that you can become less tired, lose weight more easily, and improve your sleep. If you think you might have acromegaly, please consult your local doctor. If you don't have a regular doctor, endocrinology is the specialty, so please consider visiting an endocrinology outpatient clinic. They will perform hormone tests and brain magnetic resonance imaging scans to check whether you have acromegaly. And as I mentioned earlier, as for changes in the bones, it's said that some improvement can be seen with treatment for acromegaly, but the bones will not return completely to their original state. If the pituitary tumor itself is small, it can be removed surgically, but the bones themselves will not return to normal. After treatment has stabilized, options such as plastic surgery or cosmetic procedures to shave the bone may be considered. Also, when the bones become deformed, it can cause problems with your bite. Some people may even develop temporomandibular joint disorder. Acromegaly can cause various difficult symptoms, including appearance issues and problems with your bite. It's very important to detect it early before the symptoms progress. So I hope you'll review this video multiple times and take notes as you go. As a way to activate growth hormone, for muscle maintenance, do resistance exercises and practice intermittent fasting by not eating before bed. Make time for it. Third, practice breathing meditation to regulate your autonomic nervous system. Fourth, improve your sleep quality to make it deeper. You won't miss the golden time for growth hormone. These are the methods I've introduced. Here at YouTube Medical University, from the perspective of an active physician, we provide information that can help you become healthier starting tomorrow and also prevent illness before it happens. We share videos about preventive medicine to help you detect and prevent diseases at the pre-illness stage. I would be really happy if you subscribe to the channel so you don't miss any new videos. And if you could, give this video a rating, whether it's a thumbs up or a thumbs down,